Hello, everybody, and welcome to another ICS podcast. I'm Shannon Wallace, and this is my yearly ICS workshop podcast series where I get to talk about the workshops that are going to be presented at ICS 2024 in Madrid, Spain this year. So we are really excited because it's not that far off. So for those of you who are listening for the first time, ICS 2024 will be from October 23rd to October 25th in Madrid, Spain, and it should be a jam-packed, really fun-filled conference with lots of educational opportunities and a great chance to meet some amazing friends and colleagues from around the world. So today I'm really lucky in that we're going to be talking about workshop number 9, which is novel therapies for benign prostatic obstruction, technologies, and practical instruction. And this workshop will be held on Wednesday, October 23rd from 2 p.m. to 3:30 p.m. And so I have the chair of this workshop, Dr. Luca Cindolo, with me today, who is going to be kind of giving an overview of the workshop as well as discussing some of the topics that he's going to be covering. So Dr. Cindolo is the Chief of Urology at Villa Stuart Private Hospital in Rome. I'm so excited that you're here to just have a conversation with me today. Thank you so much, Luca, for joining me. It's great to have you on.
Hello, Shannon. Hello to everyone. This is a great opportunity for me to be the chief of this workshop. This will be, I think, a great meeting because if I look at the program, I will be more than curious to attend to several workshops. Our workshop is probably one of the most innovative in male urology because we would like to cover with great experts in this specific field about minimal invasive surgical techniques for benign prostatic obstruction. We know that in this moment, the attention for the men for the preservation of sexual well-being, together with the good disobstruction, so relief of symptoms and benign prostatic disease management, is one of the key of the concern of all these men. Our population is growing and probably we will face in the future a lot of new old. We have men with good vitality. We have to respect all this part of their life, probably also our life in the future. So I am very proud to present our team and do this effort all together. We will cover, of course, clips and vapor therapy instead of embolization, instead of transperineal laser ablation, and we will have very experienced men in the topics. It's not just a lesson, but it's a true workshop, and we will have Feras Al Jaafari from United Kingdom, very expert in all these minimal invasive surgical techniques. We will have Riccardo Bertolo, that is one of the best Italian guy on this topic because he's very focused. He has done a good paper, already well published, very recognized around the world about laser ablation, of course. We will have Dr. Socarrás, also for other kinds of disobstruction, and I will cover the management of all these technologies altogether. So I believe in a great interaction. I believe in a good teaching value of this workshop. So I think several attendees will be interested in our workshop.
Yeah, I mean, it sounds like very comprehensive. It's sort of, you guys are covering really the depth and breadth of techniques and technologies out there. And so, just curious, who do you think would mostly benefit from in our ICS membership from kind of joining this workshop? Like who do you think would get a lot out of listening to the experts in this field talk about these techniques?
I think two kinds of urologists will be very interested. One is the young urologists, because they are curious, they are involved in the management of the therapies of the future. And this is probably the more expanding part of our routine job. So they will introduce in the future IT, UroLift, Resume, embolization, TPLA, and whatever stands in the future in their routine practice. On the other hand, I think that the more mature urologists will be very interesting for that because they can introduce this also in private practice and ambulatory setting offering of this technology. So I think we have to do a good job for at least these two kind of population. Moreover, I think people involved in physiology also should be very interested, because we are now discovering a new way to understand physiology of ejaculation, physiology of micturition, physiology of LUTs overall, thanks to the minimal invasive surgical technique and technologies.
It sounds like it's a really comprehensive workshop that would benefit a lot of our different membership in kind of all stages of their career. And even if they're not necessarily urologists, it sounds like some of the basic science folks, even the physical therapists who maybe take care of these men, some of our nursing colleagues might really get a lot out of hearing about these technologies and these new techniques that are going to become more kind of a common practice. And so, for the members of the ICS membership out there, do you guys plan to have kind of an opportunity for them to ask questions and to hear some of these cases that you've had in your clinical practice?
Yes, it is absolutely is the spirit, is the inspiration of this workshop. Is not a lesson. I've already said this is an open and clear sharing of experience, and also a tentative to expand our knowledge to all the attendees. The role of the nurses will be also highlighted in some part, because especially for office management of this technology and techniques, the role of the nurses is growing a lot. Probably they can prepare, also pre-counsel our patient before these techniques, because this is a work that takes a lot of time, needs a very real and careful follow-up, and should be very shared with the patient in terms of good comprehension of benefit and balance between urinary and sexual outcomes. So I think the role of the nurses will be highlighted, and thank you for involving also all the nurses that becomes case manager in the future.
Agreed. I mean, a lot of what we do is a multidisciplinary practice, right? With all these different players who take and providers who take care of our patients. And so I think hearing that this workshop will also kind of touch base on some of the roles of the advanced practitioners, the nurses who help care for these patients is crucially important. I mean, this workshop again has been held a couple times previously in different iterations. And so I'm really excited to attend and see, the new speakers and hear from these experts and have them bring their different techniques and their wisdom to this workshop. But it's always a very jam-packed session with lots of people who sign up. So if anybody out there is interested and listening as Luca is talking about this workshop, I encourage you to go on and sign up quickly, because the spots do get filled up really fast. So Luca, in the last couple minutes here, I really appreciate you taking the time to talk with me and just share a little bit about the workshop and share a little bit about the speakers and what they plan to do. Any other last minute thoughts or words that you'd like to share with our ICS membership before they'll hear more from you in October?
Okay, thank you very much. I will say thank you for all the attendees. We fill the room. I hope we can do a great job for you, for all the attendees, especially for our patients that are our goal.
Agreed. Well, thank you so much, Luca, for joining me today. And thank you so much for listening to our ICS audience. So just as a reminder, ICS 2024 is in Madrid this year from October 23rd to October 25th. We are talking about workshop number 9, which is novel therapies for benign prostatic obstruction technologies and practical instruction. And this workshop is going to be on Wednesday, so the first day of the ICS conference from 2 to 3:30. And in order to attend, just go online, register for ICS as soon as you can, and then there'll be an option to register for this ticketed event. So thank you so much to everybody listening to us today, and thank you so much, Luca, for joining and sharing a little bit about the workshop. And I'm really excited to see you in person in a couple months in Madrid.